Senate Resolution 2, congratulating College of Osteopathic Medicine in the Pacific Northwest upon its creation.
I will now recognize Senator Alan Bates. Well, it says, just a minute. I was told, okay, that my notes here are wrong. Please forgive me. Senator Bates, I guess, will close. Is that right? Thank you. Senator Frank Morse, would you please open?
Yes, Mr. President. Thank you. Mr. President, colleagues, it is an honor today to co-carry Senate Resolution 2 with the good Senator Doc Bates to recognize the fulfillment of what would be appropriately called a combined vision, the vision of Western University of Health Sciences to build a school of medicine in the Northwest, and the vision of Samaritan Health Services to find ways to meet the increasing demands for physician services in our state. Just a little bit about Western University. Its growth is nothing short of phenomenal. The university began in 1977 with a vision to create a college of osteopathic medicine in the western United States. The founders called Dr. Pomerantz to come to California to start the college and serve as the founding president. Dr. Pomerantz and the founders had a vision, but they had no students, no faculty, no buildings, no classrooms, no equipment, and little money. On the day after Labor Day, 1977, Dr. Pomerantz set up a shop in a rented office in a building on a moribund outdoor shopping mall in Pomona, California. He had some borrowed furniture, pencils and pens, paper, and a telephone. But it was immediately clear to President Pomerantz that a school without a track record or alumni would have to seek and win support with approaches that were far different from those employed by established institutions. He knew that he had to develop a following of supporters who believed in his ability and had confidence in his vision. What followed was pre-accreditation for the College of Osteopathic Medicine of the Pacific in 1978, full accreditation in 1982, and the eventual growth of 9 colleges of medicine in the fields of osteopathic medicine, allied health fields, health professions, educators, physical therapists, physician assistants, pharmacy, graduate nursing, veterinary medicine, dental medicine, optometry, podiatric medicine, and finally, the College of Biomedical Sciences. What we honor today is Western University of Health Sciences College of Osteopathic Medicine of the Northwest, called COMP Northwest. And, colleagues, it is located in Lebanon. The college will receive its first class of 100 students in August and will become a 400-student body School of Medicine focusing on primary care. I distinctly recall the Samaritan Health Services board meeting when Dr. Larry Mullins, our CEO, broached the idea of working with Western University Health Sciences to locate a medical school on the campus of Samaritan Lebanon Community Hospital. The board listened intently, although with some degree of incredulity, but thought it would be worth pursuing, especially since Samaritan had already created a health career center on the Lebanon Hospital campus in collaboration with Lynn Benton College. Meetings followed meetings, planning followed more planning, and eventually a formal agreement was reached with Western University and Samaritan Health to create a medical campus in Lebanon. The dedication ceremony will occur this summer. But I can attest to you that none of this would have happened without the visionary leadership of Dr. Larry Mullins. So we give recognition today to Western University, Dr. Pomerantz, and Dr. Paula Krohn, who is present today on the floor, Dean of the new school. We must also honor Dr. Larry Mullins and Samaritan Health Services. Colleagues, this enterprise is a classic example of the presence of defined and compelling need, visionary leadership, outstanding management, and the ability of the private sector to accomplish great things. There is no public financing of this campus. I would be remiss if I did not also recognize the role that the Lebanon community played in facilitating this new School of Medicine. Lebanon is my hometown, and I could not be more proud today. It is a community that has struggled to find its place following the demise of the timber industry, but it is a can-do community that has welcomed in every way this new School of Medicine. Colleagues, I would pose to you this question. How many communities in our state would provide a permit to construct what is a one-of-a-kind and incredibly beautiful landscape plan on the same day that the plan was submitted. Lebanon did. It's that kind of can-do attitude that has helped this project. Mr. President and colleagues, let us welcome Western University of Health Sciences to Oregon. The College of Osteopathic Medicine of the Northwest will provide the doctors our state needs to serve our families for generations to come. Truly in the spirit of Samaritan Health's vision, which is building healthier communities together, and Western Health Sciences' vision to teach, to heal together, a partnership has been formed, and Oregon truly is the beneficiary. Thank you, Mr. President.